This song is an stimhwa. These are songs we use when a new baby is born to our families and revealed to us for the first time.
Today, we are working to take back responsibility for the health of our people. We are working to return to many of the ways that sustained us for so long. This work has resulted in the creation of the Tripartite First Nations Health Plan.
First Nations leaders came together in and around 2004. The three senior political organizations decided to work together. So that was the first hurdle that we had to overcome, was our own historical and political differences. Once we set those differences aside, we were able to come together and talk with the province of British Columbia, Premier Gordon Campbell and his cabinet members.
The fact that we walked away with a signed document was really important because the Prime Minister signed it, the Premier signed it, and we signed it. And it embarked and put us onto a road of addressing these social economic gaps.
In 2007, the Tripartite First Nations Health Plan document was created and signed by the First Nations leadership in BC, the Government of Canada, and the Government of British Columbia.
The Government of Canada makes the lion's share of the decisions. Our people, our communities, our governments, our health programs are not part of that decision-making process. That will change with this new governance model.
1. The First Nations Health Governing Body enacts policies, allocates resources, establishes services, and implements accountability measures. 2. The First Nations Health Council, advocacy voice for First Nations, participates in federal and provincial policy and planning processes, and provides leadership in implementing the plan. 3. The Provincial Committee on First Nations Health monitors health outcomes and the Aboriginal health plans of the regional health authorities, and will develop a reciprocal accountability framework. 4. The First Nations Health Directors Association, composed of First Nations health directors and other health professionals to focus on capacity building, training, knowledge transfer, and professional input and support for First Nations health programs within BC. This association will provide technical expertise and advice to the new First Nations governing body. Countries as diverse as New Zealand and the United States have already recognized the logic of this approach. They've had great success when they've adopted new, indigenous-centered models for healthcare.
Because the Crown and the government had been providing health services for Maori for well over 130 years under the treaty relationship, I guess there was an expectation that if the government was doing a good job, then Maori health status should have been the same as everybody else in New Zealand. Many weren't accessing the system, and so rather than take the opportunity to get well or get treatment or get surgery, they were basically not engaging in the system at all. And hospitals were seen as a place to die, not a place to get treatment. And so with us not even using the system to any particular extent, there did need to be a change. Hospitals and doctors' rooms and nurses needed to be far more accessible to Maori communities if we were really going to impact on their health. We went from being invisible to being extremely visible and insisting on being a participant at all levels.
When I was training to be a family doctor, I got the opportunity to go down to Aotearoa, or New Zealand, to work with a Maori health provider. And it was a real eye-opening experience for me. There I met indigenous peoples who were in charge of their health services. I worked for a Maori-run health provider, so there was Maori doctors, Maori pharmacists, midwives, what have you. And it was a real different approach and feel when I was working with that organization. It was community-led, community-run, and the community members felt immediately welcome when they came into their physician's office because it was their organization, it was their health service center. And it really opened my eyes to, what we could move towards here in BC.
When you start to change the nature of health services and start to put a friendly face at the front door, and they're not just there to go, right, come on, I've got 20 minutes to see you and then out, and they actually take the time to have a cup of tea and form a relationship and get to know you as a person, then you can do the health stuff after that.
When you call someone and say, we need to talk, someone can't say, that's not my job anymore. There's more of the realization that it is, we have to share this job of looking after First Nations health, whether on reserve or off reserve.
Effectively, what we're really trying to do is have a stronger voice of First Nations in how we administer health services in this province. We're not negotiating based on the rights and title and jurisdiction that belong to the First Nations peoples.
The interim health governance, the health council, the regional processes are designed to get dialogue in a community-driven, nation-based process.
It is not something that is from Ottawa being developed. It's not something from Vancouver. It's not something from Prince George being developed and forced onto Nakasley or Glasden or any of the communities around here. It is the people's process.
The really simple thing about all of this is that we're involved in this, that our communities are involved in it, and that we are trying to find and develop the solutions that make sense for our people, by our people, for our communities and people in our communities.
We need to do it ourselves. There's no government that's going to give us what's rightfully ours if we don't step forward and say this is where we need to go and how we're going to do it. And that's what this process is all about, to give voice to our people and to our communities.
It's a potential for actually considering future generations. And it's a potential for actually turning our health condition around.
When we're born, you wake up, you're born, you're First Nations. And there's a whole system that's built around being First Nations in Canada. And so through this process, it feels good in that way that we see that light, and it's something that we get to look at and be responsible for, and being accountable for ourselves within that way. I think as Indigenous people, it's really looking at being in a new relationship with the country.
You have just heard the vision and views of those deeply involved in First Nations health in BC. What are your views? If you have questions about the BC Tripartite First Nations Health Plan, we want to know about them. Here's how you can send in your questions and your views.